Welcome to the Comprehensive Prevention Planning Support Orientation webinar. We'll sort of explain what that's all about as we go along, but glad people could join us today. We'll do a little bit of housekeeping. I'm Stuart Oppenheim from the Child and Family Policy Institute, California. Introduce myself, and you'll introduce yourselves and the in your picture. So anyway, so housekeeping, everybody should be muted except for designated speakers. We'd appreciate it if you don't unmute yourself. Just so we can, with respect to the speakers, for respect for the speakers. But so in lieu of that, please use the chat to put any questions and comments. We'll be monitoring the chat throughout, so comments and questions won't go unnoticed. And any questions that may go into the chat and aren't answered today during the session, we will make sure that we answer in the FAQs that'll come out after this, after the various sessions. The FAQs are coming out. So, and then if you can, as I said, keep your camera on. It's always good to see who's here, and change your name to your name and your county. So with that, we'd like to start with a poll and find out who's in the room. So Mia, you want to start the poll? Want to know your affiliation? It'd be really helpful to us, again, as we do this session in addition to other sessions. So. And it looks like primarily child welfare.
I can end it and share the responses so everyone can see.
Yeah, you might as well. Thanks.
Can you see it?
Yeah, actually I can see. Yeah.
I think everybody probably can. But
everybody see it? Yeah. Yeah, so it's 42% child welfare, few behavioral health, few child abuse prevention center, probation, TA provider and consultant is the next largest group. Well, no, I'm sorry, other is the next largest group. So not quite sure what that means, but we'll find out what we do. We're going to do some breakouts later, so folks will be able to identify themselves. So, okay, I think if everybody can see the results, then we can probably stop sharing. Or no, I guess it says share results. I don't know what that.
Oh, just stop share.
Stop sharing. Okay.
I already did.
We're a well-oiled machine here at CFPIC. So anyway, moving along, it's my great pleasure to introduce Cheryl Treadwell, who's the branch chief for Safety Prevention and Early Intervention branch at CDSS. And Cheryl is really providing some great leadership in the developing process of comprehensive prevention planning. So with that, I'm going to turn it over to you, Cheryl.
Thank you, Stuart. Welcome, everyone. Hope you're having a great afternoon. Got your coffee, sitting in your right chair so you can tune in, because we have a great presentation for you today. We at the state got together with some of our training and TA partners. We recognize the need to coordinate our efforts when it comes to supporting you on your prevention planning work. And we recognize at this point that counties are at various levels of readiness, building out your prevention continuum. You're slowly trying to bridge, make connections, but know that you're in the right place. Your developmental in a way is where you need to be. And so the TA and training plan that we're designing today is designed to be tailored to your needs and adaptive. I just encourage you to take advantage of everything that we're offering you. It will save you time, minimize frustration, And it will help us identify early any adaptations we need to make along the way in terms of tailoring the kind of support that you need. This is exciting work and it takes time to do the work. Know that you, as I said, are in the right place and that we look forward to working with you in this effort. Next slide. So here are the objectives for today. We want you to know what supports are available. These are the supports that will assist you with your comprehensive prevention planning. You need to know how to navigate all what we're laying out here today, so how to access that support. Just want to orient you to some tools that we're developing. We have an implementation guide and some toolkits, things that, and templates, things that I think will be useful to you, but adapted for your use, of course. But I think they're really exciting tools you'd be pleased with to have and materials for your prevention work. A lot of you have taken a lot of steps already. A lot of you know some of these providers. They're not new to you. Some of them will be. But what I like about it is that we're demonstrating to you that we're trying to have a collective kind of view of what your needs are in the state. And it's really clear whatever we don't know the answers to, we're available to work together, to come together to resolve any kind of questions and problems. So you're going to network in breakout sessions with your support providers that you've been assigned to in cohorts, and you get an opportunity to engage with them a little bit about your CPP efforts. So I'm not going to hold it up any longer, and there's some good stuff, as I said, that you have to look forward to it, and so I will turn it over to Stuart to kick us off.
Great. Thanks, Cheryl. And really thanks for your leadership in making all this happen. So again, I'm with the Child and Family Policy Institute of California. Hopefully you've all heard of us, but if not, just so you know, we're a private nonprofit organization that was created almost 20 years ago we were created by the County Welfare Directors Association. We're independent of that organization, and we really our goal is to support the public human services system in doing its job better in any way that we can do that. So one of the ways we were very pleased when CDSS approached us. Cheryl did ask us if we couldn't help sort of find a way to coordinate or explain the coordination of the activities that are being created to support the comprehensive prevention planning efforts across the state. There's some great organizations that are doing some great work, and I know you all have been interacting with them. We'll hear a little bit from all of the organizations in a bit, but just a lot of really great work going on. This is an initiative that is, I think, very unique in the amount of attention that the department has paid to supporting its implementation. I think the department's doing a great job. The other agencies that work with the department are doing a great job, but sometimes it feels a little bit disjointed. So we don't know that everything is coming together. Or coming together in a way that supports the work that's happening at the county level. So CDSS asked us if we couldn't bring the support providers together and try to make some sense of that in a way that could be communicated to all of you. So our purpose today really is, and some of this, both the purpose and the overview of the agenda really are repetitive of what Cheryl was saying, but our purpose is to tell you about the agencies and resources that are available to you to support your comprehensive prevention planning, to give you an opportunity to hear from the major support providers, the people who've been doing a lot of work behind the scenes and in front of you, to make sure that your comprehensive prevention planning is the best it can be, for you to hear about some specific tools and resources that are available, and some that are planned. And we know that we're sort of midstream in this work. You all are midstream in doing your planning, but the supports themselves are midstream, that there's so much to be done to support you. A lot of stuff is in place, but a lot of stuff is being planned. So we're going to talk about both what is there today available to you, as well as what's going to be available to you down the line. And we thought it was important to do that. We didn't want to wait for it all to be done and then say to you, well, okay, now here it all is, because that may be several months from now. We want you to know what's available now. We want you to know what's coming so that you can use that to plan your planning efforts. So we'll hear about that stuff today. The specific tools and resources, again, available and planned, and give you an opportunity to meet with the lead support providers and the peer counties that we'll talk a little bit more about how we've tried to organize the 49 counties that have opted into comprehensive prevention planning in a way that allows you to have a peer cohort that has a lead agency and a place where you can all kind of be together as a cohort. So our hopes for today are really that you walk away kind of understanding what's there, what is that sort of safety net under your planning efforts that will help you get from where you are today to getting a plan completed and submitted to the department by January 31. So again, that's where we hope we end up today. We hope that we have a lot of really good information that we can share with you. So the first thing we want to do is talk about those major partners for support. So we have 4 agencies that have been doing a lot of work and a lot of work that you've seen that really is supporting your comprehensive prevention planning efforts. The Department of Social Services, Strategies TA, Casey Family Programs, and Caltrin are all doing heroic efforts to make sure that the work you're doing on the ground is supported by whatever they can do from a statewide perspective. So I'm going to start with turning it over to Kelly Winston, the Bureau Chief of Family Centered Safety and Support Bureau at CDSS, and Hillary Conrad, who's the Chief of the Office of Child Abuse Prevention, to tell you a little bit about what CDSS is doing in this area. So Kelly, Hillary, take it away.
Thank you, Stu. Thank you so much. So good afternoon, everybody. We wanted to take this opportunity and talk to you a little bit about who we are, share a little bit about who we're working with, and we wanted to have a chance to get you familiar with and to know our teams. So we thought we'd start a little bit by giving some of our background and some of our interest in the work that we do and why we think prevention is so important. As it says on the slide, I'm Kelly Winston. I'm Chief of the Family Centered Safety and Support Bureau, and along with Hillary in the Office of Child Abuse Prevention, we work with Cheryl in the Safety Prevention and Early Intervention branch. We want you to hear those names and get familiar with them. Some of you know that we've reorganized the bureau or the division recently, and those may be new names to you. So a little bit about me. I've been a social worker for about 20 years. I've worked in child protective services for most of that. I was an ER worker, an adoptions worker, and I did some family maintenance kind of work in a couple of different counties. And I came to this state in about 2009. Since then, I've been working mostly on front end type of programs to ensure that we have good assessments of families, that we're really doing our best to get families what they need, whether that's something to prevent them from coming into care or ensuring that they have what they need if services are required. We've been doing a lot of work lately to try and ensure that we expand some of our services to really touch and create this continuum of prevention. And that's really consistent with some of the vision that Cheryl and Hillary and I share in creating that continuum to make sure that we work further upstream, that when they are first coming to the attention of child welfare services, we give them what we need to try and prevent that entry into care, and then moving on throughout that. I'm really proud of the work that we've done in the Bureau, and the staff here are here to help. We've had a lot of new programs come to our attention, and this one really is at the forefront. This most recent growth that we've had includes this important reach into prevention. It's the idea that we want child welfare agencies to work more upstream and support those families before they enter care.
And I'm Hillary, as Kelly mentioned, and I'm the Bureau Chief for the Office of Child Abuse Prevention. And a little bit about me, I actually recognize a lot of the faces and names that are here today. I started out as an analyst within the Office of Child Abuse Prevention back in 2015 and have worked my way up. But one thing that really sticks out to me is when I went out for my first county self-assessment and came back going, oh my goodness, I need to know everything that is happening in the community in order to really think about prevention more holistically and all the different players that need to be involved in building a prevention network. So that really stood out for me. And prior to working for the state, I worked for Missouri Child Protective Services as a social worker. And when I was there, I just realized we needed to provide our families more supports and services. And the best way to reform child welfare was to really start working in prevention work. So that's kind of how I got started in it. And that's how I continue to be involved. And I'm very passionate about being in the Office of Child Abuse Prevention, along with having a very dedicated and hardworking team. I'm excited about comprehensive prevention planning work because it really does allow us to think in a different way about prevention and truly breaking down those silos that exist that may be causing additional barriers for families and moving more upstream to provide services along the entire continuum. So very excited to be here, very excited to be partnering with Kelly in this work because previously OCAP in some ways was a little siloed within the department.
So one of the things I first remember hearing when I first started my work in child welfare was if we could only fund prevention, we would be able to, prevent all the hardships that we saw families going through. And I really am excited to be in a position to finally be able to really lift that work up. So not only, I mean, we've been doing prevention work in California for quite some time, and I feel like we're ahead of the curve. But with this program, it really enables us to go further and really focus on comprehensive prevention planning for the first time in a long time. And to do this with both state and federal support is truly an opportunity that we really don't want to miss. And our ability to do this, my bureau's partnership along with OCAP and work with Cheryl, we really have that opportunity to enhance prevention, improve early intervention services, not so just that we can prevent maltreatment and entries into care, but so that first and foremost, we can create an environment where we focus on true family well-being.
One of the reasons that Kelly and I have been partnering in this work is OCAP back in 2019 worked with County Welfare Directors Association to start a voluntary prevention planning effort where we asked child welfare leadership and child abuse prevention council leadership to come together to form a team with no funds, just that they decided that it was important to develop a prevention plan that was focused on primary and secondary tertiary strategies. So our role has been in this new effort, this comprehensive prevention planning work, is to make sure that we're thinking about all the work that's already started and figuring out the best way that we can align or leverage some of those activities. So we continue to be involved in that way. And as you all know, we provide technical assistance to the counties and their OCAP funded providers on how to improve their services. So the work aligns with us perfectly.
And so just to highlight a few things that we have been working over the last couple of years. So we've been working really hard to implement California's vision of the Family First Prevention Services Act. So in those last 2 years, we've incorporated the federal program into state law. We've held a number of summits, convenings, and learning conversations, and developed an advisory committee to inform the state's 5-year prevention plan. We've also allocated $50 million of federal funding and another $200 million of state funds to support local prevention planning. We have provided and will continue to share lots of guidance for counties who opt into the FFPS program, and we'll be posting regular regular FAQs on our website, the first of which was posted today. And then as you'll hear more about today, we're coordinating quite a lot of technical assistance to help counties and tribes realize their prevention goals.
So we have two mighty teams of analysts that we're bringing together to provide the support. They couldn't all be with us today, but the ones that are here, I just ask that you go ahead and introduce yourselves in the chat. And I will go ahead and pass it over to Strategies TA, one of our other mighty partners.
Great, thanks. And as we do that, I want to just really, again, acknowledge your visible and supportive leadership in this work. I think I acknowledge Cheryl's leadership, but the two of you as well have been both out there and providing that extremely valuable leadership, and it's much appreciated. So, and then yes, we'll move it to Strategies TA, an organization that everybody may not be familiar with right now, but hopefully by the end of the prevention planning effort, everybody will know about Strategies TA. They provide great support across the state. So we'll introduce Lola Cornish and Sarah Lacroix, who together are the directors of Strategies TA. So Lola, Sarah, take it away.
Thank you. Just wanted to give a little bit of history of our work in this arena. There's been many different iterations of strategies, several, I should say. And when we were still Strategies 2.0, we were engaged by the Office of Child Abuse Prevention to participate in that January 2019 summit and actually to assist during the process of it. And ever since then, we've been engaged in this technical assistance journey. 2 years ago, we changed our name to Strategies Technical Assistance because we let go of our training arm and really wanted to focus on helping counties to do this work and do it well. If you can go to the next slide. This map reflects the counties that we've been engaged with. So you can see there's different levels of support that we've been offering. For prevention planning counties, what that means is that there is already a prevention planning team working toward many of the same goals as the comprehensive planning. And again, as Hillary stated previously, that involves someone from child welfare, as well as someone from the Child Abuse Prevention Council. So they formed a team. They had to take 10 people with them to the summit, and we've added on several counties since then as well. Oh, thank you. Someone just shouted out one of our consultants. We appreciate that. So this map shows you the prevention planning counties where there's a cemented prevention planning team. There's also counties where we offer support to the Child Abuse Prevention Council to gear up to start this work. The outreach counties are those that we are trying to engage with and trying to get them to that CAPC support level. And then we do have a couple of areas where we offer regional support. One that I'm very familiar with is the Tahoe, Truckee, Placer, and Nevada kind of triangle, where the Tahoe Truckee region spans 2 counties. And there you see the total, that map is updated since June of this year. And the total number of hours by the type of consulting that we've offered is for the entire 2022 year. Next slide. So these are some alignment objectives that are really core to our practice and to our thinking. And I'm not going to read them all off to you, but as you can see, they pretty much align very well with the comprehensive prevention plan. And Sarah is going to talk a little bit about our plans moving forward, what we're doing now in terms of technical assistance for the comprehensive prevention plan.
And thank you all. So nice to see the shout outs in the chat. We really appreciate it. And so nice to be here to talk about all the work that's available to counties from all of the support providers from the state down. So, I'll just share really quickly. I really have enjoyed this partnership, I will say, with the Child Abuse Prevention Center. We are a unique program in that Children's Bureau of Southern California and the Child Abuse Prevention Center co-lead the Strategies TA effort. And that's not, I find, for the most part, a typical kind of structure, and it's been wonderful and really, really a strong connection between the two of our agencies. So thank you. I want to talk a little bit about some of the things we'll be offering. All right, some of these we already do, as you all know, but for those comprehensive prevention planning opt-in counties, we are going to be offering by request, and of course, as capacity allows, facilitation and support in these areas, right? So with capacity assessments that folks might need help with, creating that shared vision and the values for your group, coinciding with your governance and cross-sector collaboration, helping folks to really think about strategically and long-term both their community and tribal engagement approaches and plans. As we all know, that's not something that just happens once, but it is continuously important for your prevention planning team to be successful. We are also supporting with theory of change and creation of logic models. And from a lot of these processes comes the identification of primary and secondary prevention strategies. Coupled with that, our needs assessment, the needs assessment process, asset mapping, and that sort of gap analysis piece too. And so I'll just kind of say we've been adapting along the way to all of these processes, bringing more definition to the supports, our work, the products, the tools. And so these will be offered kind of in that module, kind of a modular based way for counties that might just, well, we just really need help with these things, but not so much these things. And so we're hoping to provide the best type of support in that way. And as I mentioned too, it is really crucial and critical for this work to be done differently and sustainably, that we are engaging community, those with lived expertise, and also our tribal partners. Next slide, please. Okay, and there are a number of counties which we'll talk to in our breakout groups today, but as the lead agency for those counties, we can provide what we just showed, the slide I just spoke about, and in addition, some of these other plan pieces. So how are you going to keep it sustainable? How might you evaluate your plans and think about communication in a variety of ways, both internal to your group and external? The data playbook, which I know a lot of folks have had a chance to hear about, and we partner with Safe and Sound on that. Thinking about how you disaggregate your data, connecting to that larger statewide network, and some of the other points here, I won't read them all off, but we'll continue to offer our support webinars for our statewide partners and opportunities for peer-to-peer sharing and learning as we continue on in this year. Next slide, please. All right, so lastly, some of the ways that we kind of think about our processes and products is creation of a TA work plan with those counties that we'll be engaging with. Some of you we already have, and we'll be updating and doing those again as we move into the type of support you'll need in this comprehensive prevention planning process. That peer exchange piece I mentioned, and really kind of focusing on concrete tools and deliverables to help you reach the milestone not only of completing that plan by January 31st, which we know has a tight timeline, but also in helping you to move forward in implementation of that plan. Thank you so much. I believe you will hear next from Casey Family Programs.
Yeah, and let me just introduce Dana. I just again would like to, and thank you, Sarah and Lola, for the great work you do to support counties. And then now to introduce Dana Blackwell, whom I hope you all know, but if you don't, Dana is probably the most passionate provided the most passionate commitment and tremendous resources to support prevention in California. Dana's the Senior Director of California Strategic Consultation for Casey Family Programs. And a lot of and she'll talk about the things later that they're doing to support you. But it's a real pleasure to introduce Dana in this conversation. So Dana, I'll turn it over to you.
Thanks, Stuart. I appreciate that. And good afternoon, everybody. For For those of you who are not familiar with Casey Family Programs, we are a national foundation working with states, tribes, and organizations across the country. Our goal is to safely reduce the need for foster care and build communities of hope where children and families are safe, strong, and supportive. To achieve that goal, Casey works along the prevention continuum to influence transformative practice and policy change. We believe FFPSA has tremendous transformative potential and believe California made that potential more likely by providing counties with the funding to create comprehensive prevention plans. In addition to our work in California on FFPSA, we lead a national FFPSA learning collaborative with jurisdiction leaders from across the country. California is represented by CDSS and CWDA. Next slide. In addition to the supports we're providing in California, I wanted to make you all aware of resources we provide on FFPSA and related to practice and policy tools across the prevention and continuum. This slide is a screenshot of our resource page on casey.org. And you'll see that there's a space dedicated to Family First Prevention Services Act. If you follow that button, you will have access to a curated list of articles on a host of topics that can be supportive of the development of your comprehensive prevention plan. The other buttons will take you to a host of other articles, briefs, and videos that can be helpful on a multitude of topics as you work to improve and transform your services for children and families globally within your county. Casey is really excited to be part of this partnership, to be part of partnerships with folks across the state. This is important work, and I know that our work together will be of benefit to children and families and community. And so to be in this community with you all is really important for us. So thank you for the opportunity and for the partnership.
Great. Thanks, Dana.
Yeah.
Oh, that's right. I'm sorry. You go ahead.
Oh, no. I'm passing to Jennifer in the next section.
Okay, perfect. And then do you want to go ahead and introduce Jennifer?
Sure. And next is Jennifer Rolls-Royce, who leads Caltrin and is a great partner in our work for technical assistance on FFPSA and CPP.
Thank you, Dana. So I'm Jennifer Rolls-Royce. I'm with the California Training Institute, or Caltrin. You may also know us from the CEBC, the California Evidence-Based Clearinghouse, which is kind of our partner project. Next slide, please. Just to give you a quick overview, we started in 2021, so we haven't been around too long. We provide free child abuse prevention education throughout the state of California. We're funded by CDSS, Office of Child Abuse Prevention Services, and our target audience are community-based organizations, family resource centers, child abuse prevention councils, basically anyone who's working on child abuse prevention in the community in California. So we offer a series of live webinars and what we call small group workshop trainings. Those are, as we said, live, but you can also see recordings of previous sessions on our YouTube channel, and I'll go ahead and just drop that link in. We also offer some self-paced courses, and then we offer a lot of concrete job aids, other resources, etc. Next slide. So our main involvement in the CPP effort has been hosting a webinar series. We hosted a series called Reimagining Prevention, which some of you may have attended earlier this year. And now we're hosting the CPP Learning Series, which is presented by Casey, that Dana will talk more about in a few minutes as well. We do have trainings available every week. So you can see the link to the calendar there and see what's coming. Again, these courses are all free. They vary from, short 60 or 90-minute webinars through, day and a half long trainings, depending on what you're looking for. And then we're also supporting this effort with a website that contains all the materials from the Reimagine Prevention and now the CPP Learning Series, and then also many other resources that would be related to developing the plan. And we'll show you some screenshots of that later on. And I think I'm passing this. Thank you. Back to Stuart.
Okay, back to me. So the next section, we're going to talk a little bit about some of the comprehensive prevention planning supports that we have available. We'll talk about a comprehensive prevention planning support landscape we've developed. So I'll talk about that in just a moment. We've already mentioned the fact that we're identifying a lead agency for every opt-in county. We'll have some more discussion about that in a while. One of the major things we wanted to do today was talk about a developing FFPS website that includes a comprehensive prevention planning online resource toolkit, which is going to be a tremendous resource. It's in development, and you'll hear a lot about that. And then Dana will come back and talk about some of the Casey Family Program support resources that she's been sponsoring. So with that, I'm going to move on. I'm going to show you this is just a bit of a screenshot of a landscape document. I'm going to stop sharing and bring up the document and talk to you a little bit about this. And we're going to, I believe, drop the document in chat. Give me a moment to make sure I've got it available here. Yes, here's the landscape. So as CFPIC, oh, sorry, I'm going to move this over. Okay, as we were asked to come into this environment of where all these supports are being developed, we started out to kind of investigate what is there, what are all the things that are available. And again, we found out it's a tremendous amount of information. So we interviewed all of the support agencies and said, what do you have there? What's available? What could we tell people are the resources that are available to them as they are preparing their plans, as they're moving towards January 31 for their plans. And as we gathered the information, we started to put together this landscape document, and it's a living document. It has a lot of live links and some that are not live yet. So we're going to, again, we'll drop it into the chat. You can have it available knowing that it's a work in progress, and it will continue to be a work in progress. We haven't quite determined where we're going to house it, but we'll continue to update it as the links become available. But the topics down the left, you can see. So for the overview, you've got the all-county letter to refer to. There's a Reimagining Prevention webinar series. It's a live link. There are webinars on the prevention system webinar series. The FAQs, again, as they come up, we'll provide a live link there. Today's webinar, the Accessing CPP Supports, we don't have a live link, but we will after today. And then you can kind of roll through all of the topics that should be relevant to you as you're developing your comprehensive prevention plan, and then see what are the resources that are available. Assessment tool. Again, we'll talk about the toolkit soon. We'll have live links to the toolkit for each of these areas as they come online. Again, all of the things that you can use as you develop your comprehensive prevention plan. And a lot of these, you can see the two asterisks denote that it's something that is a plan component. So as you're doing your plan component, when you're talking about tribal engagement, are there some resources that'll be available to you? Fiscal and funding models, the CPP Learning Series. So again, we think it's going to be, we think it is, and will continue to be a very helpful document. It goes through the planning deadline of January 23, and then we're starting to fill out the implementation series that's going to be available beginning in 2023. So it should be, again, kind of a go-to document that you all can use. as you're, again, developing your plans and then developing your implementation strategies. So that's just a bit of an overview of that. Again, we'll make it available. We'll keep it updated, and then I will come back to the PowerPoint. So that's one of the tools that we wanted to reveal today. That one of the reasons that we thought it would be important to have the webinar sooner than later is to let you know, as I said, things that are available now and things that are coming to you to be available as your supports, as you're doing your planning. One of the other things, we'll again talk more about this later, but the idea of a lead agency, there are 49 opt-in counties. It would be great if one organization could be your go-to organization as you have questions or concerns that you want to address. We realize if 49 counties, no one organization can do that, but Casey Family Programs, CDSS, Strategies TA have agreed to each be a lead agency for a group of counties, not necessarily to do all of their prevention planning support, but to be, I like to think of it like a triage nurse, the first person you go to find out, well, yeah, I have this question, these resources are great, but I still need to know about this. Who could help me with this? You go to your lead agency who can then direct you to the right place. And we'll have a little bit more conversation about what that means in a bit. And then the toolkit, which is a really exciting process. I'm going to turn it over to Frenny Desai from CDSS, who's going to tell you a little bit about it. And then I'm going to stop sharing and they can do some live sharing of the toolkit itself. So Frenny?
Thanks, Stu. Good afternoon, everyone. My name is Franny Desai. I work for the Office of Child Abuse Prevention at CDSS. And as Stu said, we are super excited to share with you and give you a sneak peek into what our new revamped FFPSA website is going to look like. The purpose of this website, just to share with you, is basically to ensure that both counties and tribes and providers and all of our support staff really have access to important information and resources pertaining to FFPSA Part 1, FFPS program, which was established to Assembly Bill AB 153, and the Comprehensive Prevention Planning Toolkit and Template. And it also offers us the ability to provide you with updates that can be quickly put up on our website and efficiently. And finally, it's a hub of information regarding technical assistance and support. As you've heard throughout this presentation, we're really focused on supporting you and the work that you are doing to complete your comprehensive prevention plan, and we want to be there for you. And so we want this as a resource for you to be able to utilize to help support that work. And so within this website, we will provide some foundational information, and that includes about the California 5-year Prevention Services Plan, the Family First Prevention Services Program and the governance structure, information regarding tribes and the FFPS program, comprehensive prevention planning, both the toolkit and a template, FAQs, and hopefully, as I mentioned before, ways to access technical assistance support. Additionally, included in this website, we will have the toolkit and template, and the toolkit will be divided into different sections, and each of those sections will represent specific areas of the comprehensive prevention plan, both the mandated and additional supports or additional parts of the plan that you may choose to include. We've made it into sections so that counties and their partners have the opportunity to kind of choose what they want to look at, what they want to work on first. The toolkit will be divided into resources, guiding questions, ACL information, as well as definitions of what that section will include. Additionally, we, as I shared before, we'll have a template. And again, just as a reminder, this is an optional template to use. Counties and their partners may choose to use this template or may choose to use another format to submit their comprehensive prevention plan. However, we wanted to offer this option as well. And so now I'm going to kind of go through a little bit slowly. And just as a reminder, this is a sneak peek of our new website. And hopefully we hope to go live very, very soon. Karen?
Hello, can you hear me okay?
Yeah.
All right. So would you like, so I'm going to hit the share screen button so I can go through the pages.
Yep.
Okay, great.
Thank you, Karen.
Perfect.
Sure. Okay, everybody can see okay so far?
Uh-huh.
All right. This is, you saw a preview, a screenshot that Freddie shared with you. So we'll go over, I think, 6 pages that we've got in the works so far. This is the Family First Services Act FFPSA overview. We have some buttons here that when we have these other information pieces ready, we'll link to the FFPSA Part 1, FFPSA Part 4. This is what kind of this page looks like. When we scroll down just a little bit, we talk about the Family First Prevention Services Act, and then we have some additional provisions. What I thought too would be a nice idea is if people want to click and read more, if there's some extra information, I've created sort of a one-pager just as an example. So you'll notice in this header area, it says FFPSA Part 1 and Part 4 highlights. So if you click on this, I'm sort of creating these other one-offs that will help, to highlight information that may or may not, maybe a little bit better as kind of a standalone document so the page doesn't get super, super long. So that's one of the things that I thought might be a good idea if need be going forward. So that's what we have on this first page. We also have the contact us stuff on the navigation bar and also some quick links. So as I get more information with email addresses and links and some of the other pages created, this will be kind of a work in progress. Once I have a final, I'll copy this to the other web pages as well and modify those as needed. So this is just a view of the first page we have so far. Next, I'm going to go ahead and go to the California's Vision for Prevention site. And what I've done with these headers is I've kind of used the same header, but then changed out the people for each of the different pages. So, going forward, we'll just have a wide variety of folks to add to these header areas. And again, this is just a navigation bar, updating that as we get information and the website, we get final content for that. So this is just the vision, just kind of some paragraphs. I'm going to be adding some buttons here. For right now, they're just simply links. So again, this is a work in progress. So instead of having these links to the other respective portals or web pages, I'll make it a little more aesthetic and add some buttons for these. So that's in the works right now. We also have this section called the Family First Prevention Services Act Part 1. This section is actually going to be moving to its own page. We were talking about that during a meeting and just thought it might make a little bit more sense. And of course, we'll link to that. So we'll be moving this to its own page. And again, work in progress. We have also the state implementation for 4E prevention services. And we have this graph that was requested to be created. What I'm going to do with this, since it's a little bit small on the website, I'm going to make this sort of a thumbnail. When you click on this triangle, it's going to open up kind of in a full view. So you'll be able to read it and see the information a little bit better. So that's coming soon as well. And then towards the end of this page, we have the legislative declarations. And then we have a next step, which is a timeline that will be coming soon as well. So again, that's the California's Vision for Prevention. The next.
Karen, if I could just stop here for a second.
Sure.
Sorry, Karen, if I could just stop and just explain a little bit more, just
Yeah.
as we're going through this page. Thank you. So I just wanted to share with folks that what we're trying to also do, as Karen described, is provide some visuals to go along with these pages to represent kind of what we're thinking about. And as Karen described, the visual with the triangle, that's really representing the 3 prevention levels and how FFPSA fits into the larger FFPS program. In addition to that, each of these links, such as the Trailblazers portal, that will be a link which will allow folks to kind of communicate with each other. It's going to be a SharePoint site which has already been established through prevention planning. However, we're going to enhance it a little bit, ensure that folks that are interested in using the portal, it's an invite-only section, but if you're interested as a collaborative team to share documents, to work cross-collaboratively across counties and with your partners, it'll be a site where we can do that a little more adequately. And then also, as Karen will kind of go through, we'll have these other pages that are really representative of that foundational work. What is the program? What is Family First Prevention Services program? What does that governance structure look like at our state level? And the FAQs and of course, program highlights. But each of these sections we hope will take you to a page that will help support your work moving forward. Thank you, Karen. Please go forward.
Sure. Okay, so the next web page we'll look at is the Comprehensive Prevention Plan Toolkit and Template. So once again, we have a header, different images. We have the content. We have a lot of questions like, what is the Comprehensive Prevention Plan? What are the required components, and so on? Who is responsible for completing? And then just kind of moving down to some of the required elements. That's these items that show up in bold here are the required elements for foundational work. And then we have just a few other questions. And then at the very bottom here, we also have buttons that will link to the Comprehensive Prevention Plan Toolkit, and then also to the template. So I'll be linking those when we have that information as well. So still a work in progress, but this is what we have so far. Next, let's see, this bar's in my way. Let's see, sorry guys. Cross-sector collaboration. This is the cross-sector collaboration toolkit. I'll be adding more information here in the context section navbar. Again, this graphic was provided. This will probably move down when I add some quick links to the navigation side. So once again, I'll make this a clickable graphic so that if somebody wanted to print this out or look at it, you know, in a little bit bigger, you'll click on it and then it'll open up in its, you know, kind of own window so that it'll be easier to read. So this page, I've had a little bit more time to work on it. So this gives you a better idea of some of the other graphics that I can put, you know, on the pages just to make it look a little bit more aesthetically pleasing. So we have these, you know, define cross-sector. We have all these different sections, resources, etc., and then guiding questions towards the bottom. Okay, so that is the cross-sector collaborative toolkit. And then we have the last page. This is called the theory of change. And this one doesn't have anything yet here in the sidebar. Again, working progress. And again, this is just the content is up here. And we're just going to be adding some additional graphics later on. So it's define theory of change. And then we have some questions, resources, guiding questions, kind of like that other page. I just haven't added the icons and elements to that yet. So there you have it. If anybody would like me to go back and take another look at any of the other pages, or if you have any comments or suggestions, I'm happy to hear, or I'm sure you can email Freddie or myself. So any questions for me?
Thank you, Karen. So just as a reminder, so what Karen's sharing with you now, the cross-sector collaborative toolkit and the theory of change toolkit, those are two sections of that comprehensive prevention plan. And so we will have, for each of these sections, you'll be able to go to a specific page that represents whatever will be in the comprehensive prevention plan. So could it be, for example, asset mapping will have a page for, logic model, we will have a page for different parts of each of the elements of the comprehensive prevention plan, we will have a page specifically dedicated to that. And as Sharon shared with us on the cross-sector collaborative page, it's going to be standardized. We'll have a definition, resources, is it a required element based on the ACL? And then finally, an example or a visual along with guiding questions. And these guiding questions are really to support you in the writing of your plan and what information we hope to kind of gather from you regarding what will be in your plan and your next steps. And so we hope that this will be a resource that you can use throughout your comprehensive prevention planning process. And please share with me any questions that you may have.
And there's some questions about timing, rollout, and then also in terms of for each of those pages, when we go back to the landscape, we will also put on that landscape the link to those specific sections. Anyway, that's not a question for, that's just kind of let people know that there'll be like like you'll have it on there, but there'll also be if they use the landscape. But anyway, in terms of the rollout.
Sure. Great question. So we're hoping that Karen has already started. We've done a lot of, we've had the fortunate ability to kind of communicate with our advisory committee and our tribes to get some feedback. So as this feedback is rolling in, we've been incorporating this information into our website. And what we are planning to do is we hope to go live with the website by the end of the month, at least with the beginning pages and with the start pages of our toolkit. Any other questions?
I think it's just a lot of positive feedback about what a great resource this looks like. So
would you like to see kind of the specific areas in the CPP toolkit that we plan on sharing? Would that be helpful for folks? We can go back.
Yeah, we certainly have, you have time, so go ahead, I think.
Okay. I think, Karen, that would be on the second. And probably, okay. So if we scroll down a little bit. So these, of course, will show you, these will be our links right here where it says buttons to go here. These will be our links to the main web pages and website pages. And then from there, we'll go into the toolkit. Might be the third tab. Thought it was the second tab. I think it's the third tab. There we go. Down a little bit further. So here are those elements as a reminder. And what we're going to do is we're going to have these linked and two specific sections of the cross-sector collaborative, of the specific sections of the comprehensive prevention plan. And so each of these will have, so if you're looking at safety and monitoring, we'll go into a toolkit for safety and monitoring. If you're looking at coordination of mental health plans, that will have resources for mental health plans and coordination with public health, sustainability, those types of things. Is there an update to the readiness assessment and tool? So I believe Dana and her team are going to talk about the implementation guide, which is our which is founded or based on the readiness assessment tool. Can you scroll up just a little bit, Karen, just so that folks can see a bit on. So we've divided these into two columns, just as a reminder for folks that, you know, some of the work that we're asking our cross-collaborative partners to do is the foundational process work. And then, of course, there's the implementation and planning work. So that includes your foundational work is those assessments and leveraging off assessments that you already may have done, such as the county self-assessments, community stakeholder engagement, completion of a community strengths and needs assessment, gap analysis, establishment of a cross-sector collaborative team. All of those are really that foundational process work that has to be done prior to really beginning the planning and implementation process. And then from there, kind of defining your structure. What is it to develop that theory of change and logic model? What is your internal or your cross-collaborative structures governance structure? We here at the state level have our governance structure, how we get feedback from our stakeholders and from our tribes, and then how that information is shared with other partners and other state departments. We want to kind of see that same process within our counties as well and within our cross-sector collaborative teams. Again, a summary of that assessment. How are you selecting your candidacy population? How are you conducting your evidence-based practices selection from those well-supported practices? What is the primary, secondary, and tertiary prevention strategies? What are the strategies to really address the needs within your county to make sure that we're meeting the needs of our primary, secondary, and tertiary populations? What is your workforce and training and development folks? What are the teams going to look like? What is that process going to look like? Safety and risk monitoring, as I mentioned, and of course, the coordination of mental health plans and public. So we're going to continue to roll this out step by step. And so we are hoping that you find this a very valuable resource. And thank you all for your time this afternoon.
And as Andrea put in the chat, we certainly have time for questions if folks have questions or thoughts or suggestions. I do have sort of an unrelated to the toolkit question. I had somebody was asking me how they can, how they get involved in comprehensive prevention planning. So if there are people on the call who are not connected to their comprehensive prevention planning efforts, you should check with either your child welfare director or your probation chief who should be leading those efforts in your county. We also will have some breakouts where the counties you may see some other people from the county, but yeah, we will. And go ahead, Franny.
I'm glad you mentioned that, Stu, because we're actually working on that right now. The team has worked really, really hard, along with Karen, have done wonderful work on helping me create this website. And the team is actually working on that contact list. We have something in process right now so that you'll kind of know who your county contact is, who your tribal contact is, and hopefully all of that information will be posted on this website so that you'll be able to go there and say, okay, I really want to get involved. Who do I contact? Who do I get to kind of get to know? And there'll be an email address for either the child welfare contact, the probation contact, and a tribal contact. And this is based on the information we received back through a survey, and of course through when we requested who was going to choose to participate in comprehensive prevention planning and electing to receive state law.
Good. I think that was helpful. Oh, go ahead.
Yeah. And just as a reminder, I think a lot of questions that I often get from folks is kind of that difference between Family First Prevention Services Act Part 1 and our Family First Prevention Services Program. So again, our Family Services Prevention Services Program is established through our state law, Assembly Bill 153, and it's really where that comprehensive prevention plan lies. It's talking about the primary, secondary, and tertiary prevention strategies. Whereas our Family First Prevention Services Act, Part 1 is our federal legislation, which is focused on that tertiary prevention. And so we do try and make that distinction here on this website. And so I just wanted to make sure that folks were aware that this website will incorporate both information about FFPSA Part 1, as well as the Family First Prevention Services Program, which is unique to California.
Great. I think that's really helpful. We have a question about another question about the readiness assessment that, I don't know if you can see the comment on the quote, but it's that it doesn't seem to be a requirement, though it was included in the ACL. So I don't know if you want to answer that or.
Yes, yes.
Okay.
So it is included in the ACL. I think may have to update this. It's that the readiness assessment and the capacity assessment, completing those are optional, but we want to know, how are you preparing for planning and implementation? What are the steps you are taking? So a summary of kind of that involvement. So yes, it is optional. We encourage folks to kind of consider doing the assessments. So again, the capacity assessment, and we'll have that link to this website, just as a reminder, is really a way of assessing your capacity and your motivation as a team for change. Are you motivated? Are you prepared? Are your partners ready to take on this task of really developing a robust comprehensive prevention plan and beginning that process of implementation? So that's kind of the role of the capacity assessment. And our teams here and our CDSS strategies and Casey Family Programs, we're all working together to hope that you, to support you in that process if you choose to kind of complete that capacity assessment. The link, it's a Survey Monkey link. That information does go to us at CDSS, and then we share it with your TA support providers, the information. Now, the readiness assessment, and Dana will kind of describe the implementation guide, which is kind of the revamped readiness assessment. But essentially, we're hoping that folks will take a look at that and consider it. But we are requesting that folks consider it as a summary and include that information of how are you preparing to really implement and plan for your comprehensive prevention.
Great, thanks. One more question about will resources listed be county by county?
Sorry, one more time, Stu?
Will the resources on the website be will they be county specific?
Oh, okay. So they are not going to be county specific. However, I mentioned the Trailblazers portal earlier. And the Trailblazers portal is a SharePoint site that really will allow counties, so you'll have your unique county site, and it'll allow you to upload documents, such as a template, for instance. You could upload your own template. You could upload the other assessments and things like that. And you can work collaboratively on the site. Some people use, I think it's called a box. Other people use other sorts of shared sites. And we have this available to cross-sector collaboratives if they are interested in using it. It is an invite only. It is already up and running. So folks are welcome to email the FFPSA Prevention Services inbox. And if somebody could put the email in the chat, that would be wonderful. And basically, what can be done is that you can share that information, you can upload it, work together, but also you can work across county lines. Say there's a resource that another county has and they want to include that and share it with partners, they can do that. In addition to that, there'll be a discussion board to ask questions. There'll be announcements on that page. So we hope it's an additional supportive resources for all of our cross-sector collaboratives to use. Again, it's optional for the cross-sector collaboratives, but we want to make sure that it's out there for folks to use. Thank you, Elizabeth. And so again, feel free to email that inbox if your cross-sector collaborative team is interested, and then they will pass it on to us and we can reach out to you and ask you for details. So every single member on your cross-sector collaborative team would have to give their agency, their name, and their email address so that we can send an individual invite to your page, to your specific page on SharePoint.
Great.
And just
Thank
as a
you.
reminder, one other quick statement. So the readiness assessment has kind of been shifted and we really now have only the implementation.
Great.
Any other final questions?
So there's one more question that's really not for you, but I think it's probably a good time to let you off the hook. I'll take the sharing back, and the question really is, I think, for Cheryl, which is, and I don't know if we should have saved these for the end or whatever, but what if California's plan's not approved by January 31? Will our county plans still be due by then? So I don't think that was for you, Franny. I think that was for Cheryl or Kelly or Hillary. So
I can take
Please
that.
drop the answer. Yeah, go ahead.
Yeah, I did put an answer in the chat, but we're really hoping that our prevention plan will hit the mark this time, and have been working with folks like Chapin Hall to make sure that we're responsive to the questions that they provided us. So we feel pretty good about it. If for some reason we have to go back and answer something else, we will take a look at timelines again.
Great,
Keep
thanks.
in mind that our prevention plan is a changeable document, so things that need to be changed later. Don't let our non-submittal at this stage be a barrier for working on your plan. However, and when we submit it, we'll be able to assist and help you with any changes if it changes anything. So.
Great, thanks. Appreciate that. So I think, again, Franny mentioned a couple of times the work that Casey Family Programs is sponsoring. So I'm going to turn it next to Dana Blackwell again to talk about all the things that they're doing to support the counties as part of their California strategies. So Dana, are you ready to go?
Ready to go.
Good.
Okay, so I'm going to talk about 3 tools that are in development or actually in process for you all. And let me start with the implementation guide, AKA the readiness assessment. I think it got the name the readiness assessment because it's based on the 9 readiness domains that is identified in the block grant letter. But what we really want to do is support your ability to deliver services to children, families, and strengthen communities. And so really, all the work that you do in developing your plan is really in service of implementation. So we're calling it an implementation guide. So the purpose then is to provide action steps and tools to guide a county team in its development of their prevention plan to be submitted by 1/31/23. If for any reason the date changed from 1/31/23, I would really encourage you to continue working hard on the development of your plan. There's a lot of components to it. It requires a lot of collaboration and analysis. So I would encourage you strongly to continue working on it despite when the deadline is for submission. As I said, the guide will follow the domains that have been the topic of the learning series that we've been putting on since June this year. So there's been some demonstration of what those domains entail and how you might begin to think about the application to your plan. But before we release the guide, which we hope will be soon, we've done a few things to ensure that the guide itself has a level of exactness, that it's user-friendly, and that it is not redundant. So the first thing that we've done is used a team of national experts and researchers and implementation practitioners to review the guide to ensure that it contains best practice, right? That we are leading you down a path that is sound and foundational. The second is the implementation guide will have tools and templates, right? But we also don't want to recreate the wheel. We don't want to create things that are redundant or confusing for folks. So we've been going through tools, the universe of tools and templates to ensure that what we provide in the implementation guide, again, is in accordance with best practice, is easy to understand as you're developing your guide. And then finally, we're having a usability focus group, if you will. It actually happens tomorrow. We have a small group of child welfare leaders and tribal representatives and probation to look at the tool and let us know, is it approachable? Is it redundant? Is it helpful, right? To make sure that once we release it, and we put it in your capable hands, that you'll be able to take action with the guide, with your teams in your counties. So that is the first tool that that is almost done, and hopefully we'll have out to you soon. It will reside on the website, the CDSS website that Franny and Karen were just guiding us through. The second tool is a media toolkit. Communication is really, really important, right? Counties want their communities, their partners, their families to know what they're doing, right? This work to be successful, to be sustainable, and to really transform what happens for children and families has to be inclusive. And so communicating what you're doing throughout the life of your planning and implementation process, we believe is really important. And so the toolkit will include, I think of it as plug and play, IE Communications, Lori Cappy, who we've contracted with to create the toolkit, talks about, the toolkit is not about teaching you to fish, it's giving you the fish, right? And when you get the fish, you can cook it up any way you want, right? That you can take a PowerPoint that you may want to, in a presentation to your board of supervisors, you will brand these tools that are aligned with your county context, with the landscape, with the look and feel of what you all do. It is an opportunity to make communications a central part of your planning and implementation. So I'm really excited about that. We know that communication, or really that the media can be a useful tool to us. And with so many different media pathways, if you will, whether it's Twitter or Facebook, having frameworks and tools to quickly upload information that's important to your community and to your stakeholders, we hope will be appreciated and helpful to you in your process. Finally, we have the learning series. The learning series started in June, and it's intended, again, to assist counties in preparing for implementation of your unique comprehensive prevention plan. The series, like the implementation guide, maps directly to the readiness domains and addresses the requirements of the block grant and AB 153. The series has been really well attended, and we've had really great feedback, which we continue to incorporate on a regular basis. I think that the series has two really nice innovations to the webinar, right? To the webinar format. One innovation is the Q&A that happens after each webinar, right? The webinar itself is just information out, and it's a lot of information and it's really dense. So we appreciate people hanging in there and coming back, but we recognize that it is a lot of information, and that when you go back to your counties and you are sort of deciphering through and thinking through all of that information, you have some uh-ohs and you have some ahas. And for us to be able to allow you to come back 2 weeks later and ask questions related to your own county context to the experts that we've brought to bear and provide you the information, we think is an innovation that people have taken advantage of. Each of the Q&As, we're having our third one next week. But each of them have been a little bit different. This one coming up, we heard from you all in your evaluation that you wanted help with gap analysis, with logic model building and theory of change building. So we're going to do something different than what we did at our last Q&A session. We're going to actually have, logic model, theory of change, gap analysis, demos live, so you guys can bring your thinking about your theory of change and work it through with one of the presenters that was at the webinar itself. And so you can get practice, you can ask questions about how to do this very important step of your CPP. The second innovation that we're implementing with this series is actually a written documenting the questions and the answers that you have asked in each of the webinar series. Different than an FAQ, right? In each of the series and in each of the forums and each of the Q&A sessions, people have sent in questions in advance, have asked questions in those two forms. Our panelists have answered them, and we have gone back and documented the questions and the answers for each of them, for each of those questions. The series itself is recorded, and you can always go back to a recorded series. But if, for example, you have a question about MOE, right, to go back to that recording and I think they said something about MOE, let me listen to the recording, right? You can be an hour in. This way, if you think, I think they answered a question around MOE, we will have it documented and it will be bookmarked. So that information will be there for you at your fingertips as you begin developing your plans as you have questions and helping you to think through what it is that you're developing and what it is that you're wanting to convey to your partners and, sort of rumble about with your governance group. So there is that. We have earlier in the webinar here in the slide deck, Stuart showed a list of, well, Stuart, can you go to the next slide? Yeah, thanks. So this is the series, the schedule for the remainder of this year. And we have begun planning for next year. As I started to say, Stuart showed earlier in the webinar a list of dates for this learning series to continue. And so we have those scheduled out. We are really thankful for the fact that people have provided feedback in the evaluations because we're taking it seriously. We want to build something that is responsive to your needs. So I know they will be a little bit shorter. And I also know that, the domains will not change, right? Like, we think that those are the right things to talk about. And in an implementation environment, the conversation is a little bit different. So we will be listening to you, reading your evaluation and feedback. You can always, in the hubs, talk to your hub lead. And if there is feedback that you want to provide, please let them know. They can share it with us. This is for you. This is for California. This is for children, for families and communities. So we want to get it right with you. And so I think with that, I would just like to appreciate Jennifer and Caltrin because they have been a superlative partner in this work. Their website houses all of our resources. They are so smart, both about a lot of things, but what they're really also very smart about, besides the content of what you all are doing, is really how to pull together a wealth of information digitally and to run a webinar smooth. And so it's been our great pleasure and privilege, and we have benefited from Caltrans expertise. And so with that, thank you, Jennifer, and I'm going to pass it to Jennifer.
Thank you, Dana. I really appreciate it. So we've been very happy to be involved in this. I've dropped a link to the Comprehensive Prevention Planning Support webpage that we have. This is where you can go to sign up for the learning series that Dana has talked about. So I just wanted to share a couple of shots of what's available here. This is what the page looks like. There's basically 3 components. One is the learning series. One is a collection of resources, so documents, etc., and then links to the Reimagining Prevention series that was held earlier this year. Next slide, please. Okay, and so what you can see in each of these is a brief description of the differences and then links to each page. Next slide. That's the fancy animation. So here's the learning series. What you can access on these pages are the registration links for all of both the learning forums and then the Q&A sessions that Dana mentioned that are usually 2 weeks afterwards. So you have time to submit questions. You can see recordings, copies of the slides, and all the resources that are distributed during the training itself. Next slide, please. On the Comprehensive Prevention Planning Resources page, you'll see materials again listed by domain, topic, so all different materials that have come up across this entire effort that's really been going on now since the end of last year. We're just compiling everything onto this website while we wait for the CDSS one that Franny was showing us earlier to go live, and I think a lot of this will get taken over by that. One more slide, please, I think. And then lastly, the Reimagining Prevention Initiative. So for those of you who attended any of these earlier in the year, you can come here. You can get all the recordings, the slides, the resources, all the pieces that we've done so far. So those are available currently on the internet, and you have the link in the chat. Thank you. I think I'm turning this over to Stuart.
Okay. I don't know if we had any questions in the chat for that. Yeah, so we'll go. So I'm excited. You can see this is how excited I am by all the stuff that we've heard about today. I hope it reflects your excitement as well. And I'm not only excited, but a little exhausted. So I think we could probably use a bit of a break. So why don't we take 15 minutes and we will come back in 15 minutes. And do please come back. So all of the counties, as I said, we've done some organization. We've got a breakout for each of you, not one for each of you, but we have breakouts where each of you will be able to go to have a little bit more conversation with lead agencies and your peers. So take 15 minutes. Let me
Right on. Okay. Well, welcome back from break, everyone. I just wanted to kind of welcome us back in the spirit of just thankfulness for everybody being here. I mean, if you're on this webinar today, that means that you are part of the process in California, really advancing the cause of prevention. It was great to meet our fantastic prevention partners. The CDSS, Hillary and Kelly's bureau and teams were fantastic. It was great to walk through the online CPP toolkit. It was great to meet Dana Blackwell from Casey and to learn a lot about the implementation guide and the media toolkit and the learning series through Caltrans. It seems like we have some great resources coming your way, and I'll just list them. Today's webinar, we wanted to feature 6 kind of domains of support for counties. So we had the one page, actually it's multiple pages of the landscape that CFPIC put together If you remember, it was the item that Mia dropped into chat. And Mia, if you could just drop that into chat one more time, and folks, in case people didn't get it the first time, but it was that landscape that listed all of the items of the CPP kind of planning toolkit and then their related resources. If you could just drop that into chat, that would be great. So we've got the landscape. And then we had Frenny's the online CPP toolkit that was walked through, and y'all had great questions about that. We also had Dana's implementation guide, or Casey's implementation guide, the media toolkit, the CPP learning series. The sixth and kind of final domain of support that we wanted to talk about today, it's been referred to throughout the webinar so far, and I don't know if y'all have caught it, this concept or this term of lead agency or hub or cohort. So it's kind of my role right now to kind of walk through what a lead agency is and why. So the big idea with the lead agencies, the big idea is that every single opt-in county and the 4E tribes that are opting in to the comprehensive prevention plan, everybody has an automatic contact. You have a who. You have an automatic person or agency or entity that you can lift up questions, that you can surface challenges, that you can ask for support. You can say, hey, I missed something. Where do I get a copy of that webinar? But we thought it would be really helpful if every county had a lead agency or this point of contact, the first point of contact, that if you had a question, if you needed a resource, if you felt a little out of the loop and wanted to catch up, you had a specific agency or contact person to ask. And we thought that would be really helpful. So we have sort of organized all the opt-in counties into sort of 3 cohorts where there's an assigned lead agency in that cohort. But let me walk through kind of the lead agency's role first. And before I kind of walk through the role, I just want to say that this is it's an additive for counties. It does not disrupt or replace any support that you already have. If you have a county consultant, it doesn't take the place of a county consultant, does not take the place of your regional training academy. We're adding. And if you don't need a lead agency, fine, you don't ever have to access your lead agency. But for those counties who feel like it would be of benefit from time to time to access their lead agency, you have one. So again, this doesn't disrupt anything, and it doesn't replace, and it doesn't edge out anybody else who's already in a county who's providing some really valued support. This is for the comprehensive prevention planning teams to have an extra person just in case. So the lead agencies, the role for every lead agency, we have 3 of them, and we'll introduce you to them in just a moment, but the lead agencies all are expected to be subject matter experts in the Family First Prevention Services Act federally, and then California's Family First Prevention Services programs, and the related comprehensive prevention planning mechanics and the block grant, just the essentials. So every lead agency would be a subject matter expert and would know where related resources would be found. Their role is to be your first point of contact should you need a contact person. And then to help you connect, you may be a county who is coming up against something and wants a little extra support in any of the planning processes. Then you can ask your lead agency, hey, who's in California? Who might be available to come and talk to us? Your lead agency may not be the provider of that support, but they will hook you up. They will triage your request and they will point you to where you can go. So again, this is an ad and it's kind of a who, and it's a who can I call? And we thought that might be kind of the final piece of the puzzle of support. Also, just so you know, the lead agencies, as they're working with you over time, they'll be tracking the requests that each of their counties are asking for. They'll be tracking questions. They'll be tracking need for support. So as they're tracking, the lead agencies, actually, they meet together every couple of weeks, and they're going to be pooling that data so that we can continue to provide pretty strategic help statewide. So the lead agencies will be kind of a feedback loop for you. So if all counties are struggling with something with a particular theme, then that would probably be the subject of the next webinar. And so it's also a little bit of feedback cycles for you. So the lead agencies have this role. Again, every county who's opted in has been assigned to a lead agency. And I want to talk a little bit about that assignment. Mia, if you could advance, or Stuart, if you could advance this slide, that would be great. I believe you've already received a one-pager in chat. Mia, if you could drop that in one more time, just in case folks didn't grab it that first time around or joined a little bit later. So there's a one-page kind of flyer coming to you that just reminds you of the lead agency's role. And then here are the county assignments. So I'm sure nobody's listening to me right now because you're looking for your county. So let me just talk a little bit about how these assignments were made. We started out, first of all, with counties who are already working with a particular agency. So here are the lead agencies. The team at CDSS within Kelly's shop and Hillary's shop, together they have this dynamic team of analysts that are taking on the counties below in that column. And so they would be your lead agency, your first kind of point of contact if you have those questions, if you need support. So that's the CDSS. These are your counties. So if you are working in this county at all, if you are a CAPC, or if you are a nonprofit, or if you're a county consultant and you're like, oh, that's my county, that's your kind of hub. We've been sort of informally calling this. So this is sort of your hub. You'd be under the CDSS hub. Strategies TA, y'all heard from them, and we had a great presentation this afternoon from Lola and Sarah. And so they are sort of heading up or leading the team that would provide the lead agency role for the counties in that middle column. And then you heard from Dana Blackwell already, and these would be the Casey counties. So I'm going to go into the fourth kind of catch area below in just a moment, but I just want to tell you how the county assignments were made. So we hope that it makes sense. But if you're a county and you're like, that is not going to be my lead agency, I will not work with them. If that's, feel free to let us know. I mean, these are arbitrary a little bit, but here's how we assign them. We sort of sorted through the counties who were already in good relationship with one of the lead agencies. So for example, if you're a county and strategies TA is like, they've got an office in your county and they are your best friends and you go to them for everything, chances are that's your lead agency. So we started out with affiliation, close relationships that were already there. That was our first way to sort. And then the second way was if small counties perhaps do a lot of collaboration, they work together a lot, and one of those counties in that collaboration already works with one of the lead agencies, then we probably ask the collaborating county to join. And so we kind of kept counties who work a lot together as well. It's kind of the third, that was kind of the second means of selection. So we also know that not every county opted in already to the CPP or the access to the block grant funds. And so we have a special place for you, and that would be kind of in this category number 4. And we also, our tribes, the Yurok tribe and the Karuk tribe that are 4 agencies themselves that have opted in, that would be kind of in our 4th area. Because, and the reason why I pulled them out right here is because we are going to head into breakouts. And so this would be a great time for us to, in that 4th category, say, what makes sense to you? Do you think you want to opt in? How can we help you? Tribes, if it makes sense to connect up to one of these lead agencies and that CDSS strategies or Casey family programs, we want to offer that to you, but we do not want to make that choice without you. We wanted you to choose. So we have kind of some planned time in this webinar following this next couple of minutes. If you are a county consultant, please know that we are linking you up, and we want you to come along with your county. Metaphorically speaking, counties, if you ever access your lead agency for a question, take your consultant with you. This is not an exclusive process. Again, the spirit is to add so that every county has at least a point of contact, because we know in California, I mean, coming from, a real strong drive around equity, not every county has access support and has support robustly already. So we really wanted every county to feel like they had somebody and they were included in this kind of learning collaborative, this network or this hub. So for some counties that don't already have consultants lined up or don't have a relationship with Casey family or strategies, or don't know the OCAP folks very well, we want you to feel like now you do, you have that contact. So again, this is really to increase support, not to disrupt anything. So county consultants, go with your counties. And if we're going to head into breakouts, if you're a county consultant, you're like, oh my gosh, I have a county that is attached to Casey and strategies and CDSS. Where do I go? This is an artificial kind of get together time. So go where makes sense to you. Go first, but that doesn't mean that you're not part of all the other hubs participating with all your counties. Should there be meeting, if your hubs, if the lead agencies call a meeting or put an email out, get on that email distribution list, be great. We think probably the relationship is going to be a little more one way, meaning that counties will be reaching more to the lead agencies as opposed to asking the lead agencies to develop now, a process for TA and a whole TA plan for everybody. It's probably more the lead agencies are to receive questions, to receive desires for more support. And so the lead agency would be sort of triaging. So I don't want to set you up to say that every one of the lead agency is going to pursue the counties aggressively saying, where can I help? How can I help? That may not happen. But you guys will get to talk about that and make those decisions for yourself in every hub. When we go to breakout, we're going to release counties to breakouts. What we'll do is we're actually setting aside a good half hour, 45 minutes for the lead agencies to do some icebreakers with their counties and to say, how should we communicate? How should we roll together? If we already have an established process, fine, we won't change it. What do we need to add? What would make sense? At the very least, your lead agencies are going to get contact information from every county, who's the lead contact. So at least the lead agencies and the contacts for counties know each other. At least over email to just create some intimacy there around just quicker access for questions and begin to develop relationships. So we know that's going to happen in the breakout. Probably the lead agencies are going to chat with you all a little bit about what questions you have. And just really where do you go from here? If you're an RTA and you have counties across, go where it makes sense. But this is the lead agency model, this hub model is a way for county consultants to kind of roll up into some consistent communication and RTAs for you to really begin plugging in. If you are an RTA who is already providing some consultation to a county around comprehensive prevention planning, you absolutely, this is great. You are more than welcome to connect in under this lead agency model with your county. And same message to RTAs. If you've got counties across the spectrum and you have maybe counties in different kind of lead agencies, if you're just one person from your RTA here today, go where it makes sense. If you've got a team of 2 or 3, spread out. It's great. This is not exclusive. It is inclusive. And we know that county consultants and RTAs make up a lot of the support fabric for prevention in California. So we're not wanting to exclude you at all. But we have a lead agency expectation that these guys are the ones who know what's what with the ACL, with the deadlines, with how to navigate the online toolkit, where the resources are, where the webinar recordings will be hosted. The lead agencies, we hope, will provide just extra kind of support at your fingertips for the counties. So I think I may have said everything. What we'll do, Mia's going to pop up an ability for the breakouts to start. It is 3 o'clock. We'll stay in breakouts till about 3:40, and we'll come back to the large session. When the breakouts, you'll see on your screen an option to go to, yep, see, here it is. When the breakouts happen, you will select if you are a county, and again, Mia she put in the county assignment. So if you forgot already which one is your lead agency, grab it, it's in chat. If you're a CDSS county in that CDSS kind of hub and CDSS is your lead agency, you will go to breakout room 1, strategies TA 2, Casey family 3, and tribes and any county or county affiliate who's not opted in, go to breakout room 4, because we'll have a little bit different process for you. We're going to ask you some questions that would help us navigate where you ought to be or what your preference is, what makes sense to you as counties. So we're going to go ahead and I'm going to open up the breakout rooms, or Mia will open up the breakout rooms, and you will select it, and we'll see you back here at 3:40.
All right, if you guys, we're going to hold for just a moment to see if folks can get into their breakout rooms. And in another minute or so, if folks are having trouble still joining their breakout room, please drop that information into chat and Mia and I will get you moved to the room you need to be in. Thanks.
And I can help too.
Well, good, Stuart.
I'm good for something. other than-
Mhm. I don't know, it'd be better if I could see. Can you go back to the previous slide?
Yes,
If I can see the list.
Yep.
Thank you.
I have it. I always pull up when I do webinars, I pull up the thing on my phone,
Mhm.
the slide so I can see, but yeah, we can just. So should we start?
Riverside goes to Casey.
And we have some
Yep.
in chat. Jennifer Pyle wants to go to 3. And Rob Doty says he needs help.
Okay, where's Santa Cruz?
Needs to go to.
I think it's one. Yeah.
One? Okay,
I just sent it to you. Hello, everyone. Okay, well, welcome back from your breakouts. Want to get that on the recording for sure. Hi, everyone. If you don't know me, my name is Juliette Cox. I also work here at CFPIC. I hope you had some great discussions in your breakout groups just now. And so we thought we'd take a moment to reflect upon today and some of those discussions that were had in your breakouts. So I thought I would just turn it over to the lead agencies to give us a few thoughts on the discussion that went on in your breakout. So I'll start with, let's start with strategies. Who was facilitating the strategies lead agency group? Could you give us a report out of the discussion?
Sarah and I were.
Great.
Sarah, did you have something right? Are you ready?
Yes, I have a couple notes.
Okay, great.
We had a great discussion. It was so nice to meet so many of the counties that are going to be working with us and will be working with. And I feel like, also please, people feel free to put things in the chat if I missed anything. But we had some conversation around the state block grant, around the, need for templates and how that will be really helpful. Some of the ideas that were generated were around having increased number of forums or conversations for counties on how folks can work together or what are other people doing, right? So we don't reinvent the wheel. We can learn from others. We also, I know some people are very new to this process as there's turnover in counties, turnover consistently for all of us in our field. So I think a lot of what will be important too is to share what we've already done. A lot of that we have recorded so that folks can catch up. Grouping counties with similar size and demographics was an idea that came out of our group as feeling really helpful and important. More topical support around some of the plan elements. And we heard that the idea that strategies will be providing some modular based support on the plan elements to be helpful. And also how can county funding be leveraged and aligned for, across the prevention continuum. Lola, anything you'd add?
I would. First of all, shout out to, I believe his name was Peter Zaragoza, who is not part of a team, just saw the advertisement for this webinar and decided to attend anyway, and now he's ready to plug in. And then there was a suggestion for the California Department of Social Services that an errata be, or an amendment to the ACL, the block grant ACL, that clearly designates what is and what is not required. So that they're specifically referring to the confusion about the capacity and readiness assessments, I think. That's it.
So a good group conversation for the strategies group, some great next steps, it sounds like. That's good information. Thanks for sharing that. Let's move on. Casey, could you do a report out for us?
Sure. Let's see. We had a great group. I want to give a shout out to CDSS for their website. There was a lot of enthusiasm for the website, and what's going to be contained and its potential for being a really helpful tool. One suggestion was a request for when something is added to the website, that there's an email like blast that goes out and says, hey, you know, we put something new on the email. And then we had a little bit of a discussion about data, and, you know, the analysis will look different in each county. And so just ensuring that, you know, the analysis, there's no one way to cut the data. There's not something that the state is looking for in particular. I assured them that no, they're not looking in for anything particular. They want to see the analysis. I use the analogy of, you know, you got to show your math, right? You got to show your work, right? And so your county is unique and individual. And so the analysis will reflect that individual nature of the county. And then just a little bit about, you know, we have, you know, things that need to be done in the short term, and then things to be done in the long term, and having that view across the continuum of, you know, so counties can ready themselves and prepare themselves for what's to come as they're doing what they need to do now.
Great, thanks for that, Dana. Sounds like a good conversation in the Casey group as well.
Yeah.
Okay, so how about CDSS? Some reflections from your guys's breakout or breakouts. There was two, I think, where CDSS was leading.
I'll go ahead and start. We also had a good discussion, and definitely there was enthusiasm in our group as well as about the toolkit and the web design. And it was also acknowledged the data playbook, as that's a great tool to be used to make sure that we include that on our new website. There was a suggestion of drop-in sessions for counties. So just some set time and days for them to be able to interact with counties of their size. So having a drop-in session for smaller counties, a drop-in session for medium counties. There's definitely an interest in making sure that there's room and space for counties to be sharing what they're learning, and then also what work they've already done. So whether that's us making sure that that's happening through the portal, making sure that that's happening through newsletters, or making sure that we're just doing one-to-one connections between a county that is working on asset mapping and a county that hasn't done it yet. That would be very, very helpful. So that was definitely a theme that came out of our group. We also talked about how it's helpful to have everything in one place, and that sometimes that can be confusing and hard to navigate when there's so many different places that you have to go to. So there was a definite acknowledgement to be nice to have everything in one place on that website that Franny went through today. They said that they really appreciate concrete tools. So when the template comes out, that will be helpful because it gives them an idea of exactly what the plan is to look like. And then making information more digestible. So sometimes we're, sharing the block grant, being able to break that into smaller pieces, even the law, breaking that into smaller pieces. It sounds like that's definitely a theme. I think that's about all. And I remember First Five, we had First Five. So shout out to First Five. And she mentioned that there was a home visiting grant and they did an assessment process. So make sure that you connect with your First Five local partners, because you could possibly leverage some of those activities. So.
That's great. Great lead. It's a good conversation there. Anything, Kelly? I think you were leading a group as well.
Yeah, so we had a small but mighty group of two folks from one of the Title 4E tribes. So a couple of folks from Yurok Blair and Valerie. We talked a little bit about the differences between what is expected between a 4E tribe and a county, and so how we might adjust for those things. One of them brought up kind of some exciting news that apparently there's an announcement in Biden's budget where they may waive some of the requirements, the 4E requirement for EBPs specifically. And so we're waiting anxiously to hear whether that happens in Biden's budget. And obviously that's specific to Tribe. So a 4E agreement with the state, that's already something that's allowable for Title 4E direct agreements with the federal government. So that is just really good news for tribes. We talked a little bit about the challenges in data collection and analysis to inform their plan. And so we discussed some strategies for being able to meet those needs. And, you know, given the vast array of resources and supports we have, you know, represented here today, we may be tapping into some of those folks to help with that. And then we also talked about kind of the approach to the training, the workforce development and that kind of thing. And so for those folks who are wondering about that, that's certainly something that's in the works, and we're talking about how we might manage those next steps. So more to come on that, but definitely an interest and a need identified.
Great, thanks for sharing that, Kelly. Any other reflections from any of the groups that anyone wants to add in? Anything you want to drop into the chat about reflections from the discussion in your breakout? Well, it sounds like there was lots of good conversation going on and lots of great information being shared back with the lead agencies that then they can take back and work on to ensure that we can continue to get out the support that's needed for this effort to all. I heard some great things in what you guys just reported, a lot of enthusiasm about the concrete tools and supports that are either already out there or being put out there. This idea that it's great to have things all in one place, this having this one-stop shop where everything will be located. One of the things I did want to remind folks about is we are putting together that comprehensive prevention planning supports landscape, which is also going to be a step as these other things are under development. We're going to hopefully get that out very soon, where we will have in one place all of those links and tools in one place where folks can then know where to go to get all of the information that's already out there. It sounded like Strategies Group talked about, would be great to know everybody on the same page, what's already out there under and been developed so folks can grab it. So more to come on that. I did hear a lot about having more opportunity for county sharing and bringing counties together of like size, having conversations among counties. So I think those are all great things that we can build upon in building the supports for this effort going forward. So unless there's anything else for my partners, I'd like to end today on a little bit of a poll for folks. Sounds like there was some great discussion, some great enthusiasm after today. Folks learned a lot, but we'd like to ask you directly. So a few questions are going to come up to talk about today's webinar. We want to ask you, do you have more clarity about the available supports after today's webinar? And then if you do or don't, also, would you like to attend additional sessions that are statewide like this to talk about the support? Sounded like folks are really interested in getting ongoing information as stuff is released. Would you like to attend additional statewide meetings like this? And if so, how often would it make sense for you? So go ahead and take a moment, if you could, and answer the poll that's up on the screen. And then in a few moments, we'll share the results from that. Looks like we've gotten to about 3/4 of folks who participated. So should we just go ahead and end the poll and share the results? Great. Okay, thanks. So what I think everyone can see on their screen, oh, yay, that makes me happy. It looks like 92% of folks either agree or strongly agree that today's webinar provides more clarity about the available supports for comprehensive prevention planning. That was the goal. So very glad to hear that that goal was met. I would like to attend additional statewide meetings. Yes, 86% of folks would like to come to additional meetings. So good. I'm glad there was benefit to this. And so we will plan further sessions like this to bring folks together. And we'll take into account all of those great suggestions that were fed back through those breakout groups of how those might be best structured too, for greater clarity and support for counties. How often? Looks like folks are leaning toward more every couple of months. Okay, makes sense. There's a quick timeline, right, in terms of getting some of this stuff done and rolled out. So maybe more often until we get to the finish line in terms of at least getting those plans completed and out there. So and then more of the work continues, right, for really putting in place the comprehensive prevention planning in your locations. So our prevention plans and services. All right. Well, I think that ends our day. I think we ended on a very positive note. We really want to say here from CFPIC, we appreciate you, but I'm going to turn it over back to our partners over at CDSS and Cheryl Treadwell, who's going to close us out this afternoon.
Well, thank you so much. I told you this was going to be a stellar presentation, guys. I just like to appreciate all my stellar partners out there, Caltrans Strategies, Casey Family Programs, CFPIC, Stewart, and Dana, thank you for the fish story. My mouth was savoring about these plans. You can cook them any way you want. But it's been a great day. I won't prolong it. Take this information, use this information, everything that we've offered to you, take advantage of it. And have a great day. And thank you for hanging with us. We learned a great deal. We hope that you learned a great deal as well.
Thanks, Cheryl. Thanks, everybody. We'll maybe see you in a couple of months, if not before.